Hello, greetings. We're so glad that you're here today to join us. On behalf of the National Collaborative for Infants and Toddlers Capacity Building Hub, we welcome you to Justice from the Start, supporting Prenatal-to-Three with federal relief funds, early childhood education. I'm Michelle Adkins. I'm the Assistant Director of the Hub, and I'll be facilitating our conversation today. This webinar is really building upon a resource that the Hub created along with our national partners called Supporting Prenatal-to-Three with Federal Relief Funds. This document provides information about all of the different funding streams that are available to support prenatal-to-three agendas and activities. And it also provides lots of different strategies and examples of ways that these funding streams can be used both in early childhood education, maternal infant toddler health, and in family support. So if you haven't seen this resource and you would like to, we're going to throw the link in the chat, and so you can access it there. So today is the first in a three-part series of webinars that are related to this resource. The first one, as you know, is on early care and education, and we'll be talking about some of those fabulous initiatives in just a minute. But we do have two additional webinars in the series. One is on family support, and that will take place on October 20th at 1:30 p.m. Eastern Time. And the second one will be health, which will take place on the 28th of October at 3 o'clock Eastern Time. The registration links for those are going to be added to the chat as well. So feel free to take a look at those and get yourself registered. They should be, they're going to include lots of great examples about work that is happening in the family support and health arenas. Before I move on to introducing our panelists, I'd like to welcome you to fully engage with us today. If you have examples of early care and education initiatives that you are using or that you are using the federal funding for in your state or your local community, we'd love to hear about those and see those examples in the chat. We'd also like for you to fully engage with our speakers today by either making responses or asking questions so that we can fully delve into the topics and what we're talking about today. So we have four amazing speakers with us today. I'm going to start with introducing Alethea Arguelles. She is the Executive Director of First Five San Diego, which is the region's primary organization for promoting the health and well-being of children 0 to 5 years of age and their families. Alethea has dedicated over 20 years to the field of early childhood education, and she started that journey in the field as an infant toddler master teacher. Along with Alethea, we have Karen Powell, who serves as the new Deputy Assistant Superintendent for Early Childhood Strategy in the Louisiana Department of Education. Prior to joining the department, Karen served as the Regional Director of Partnerships in Childcare, which is a childcare resource and referral agency. She served as the Director of Education Initiatives at the Capital Area United Way, and she served as a faculty member and administrator at Louisiana State University. Also from the state of Louisiana, we have Libby Saunier, who is the Executive Director of the Louisiana Policy Institute for Children, where she uses her 20 years of professional experience supporting young children and their families. She's recognized for her tenacity and deep commitment to children, and she has led teams in system-wide initiatives for the betterment of children, families, caregivers, and practitioners. And finally, we have Katie Brooks, who has been with the Bend Chamber of Commerce for 5 years, leading transformative agendas for Bend area businesses, including being a leader on childcare as a workforce issue. Katie is also a member of the Oregon Early Learning Council, where she was appointed by the governor. So we're now going to give the speakers an opportunity to tell us a little bit about the initiatives that they are leading with federal relief funds. And so I'm going to stop sharing my screen a little bit so you can have a better look at Alethea, who's going to start us off.
Hi, good afternoon, everyone. I hope you can hear me okay. I'm using my earbuds. It's an honor to join you today, and of course, my esteemed colleagues that are on this panel as well. Just really an opportunity to share a little bit about what we learned over this past year and a half with our federal relief funds that have come down into our county. And so I'd like to share that we are in the process right now of really prioritizing that framework and the investments that are going to be appropriated in our county. So I'd like to share that we have successfully identified $16 million to support childcare vouchers to a very targeted population. We talk about equity in our work, and we have worked to develop a really incredible opportunity to hone in on some gap funding where we identified, locally here in our county, we have a foster bridge childcare program where we're going to be able to drive those funds to support that in between gray area time when families are reunifying. And so we're really excited about what that'll do to support the system of care for our children when we think about who are the most vulnerable. We have funds that are going to go to childcare providers in terms of resiliency grants. We also have a huge investment going towards workforce pipeline and also supporting the development of our future workforce and also our existing workforce when we talk about strong outcomes and high quality early care and education. And so we're really excited about the $16 million. Additionally, we also have another $5 million that has been allocated for early childhood mental health. When we think about the greater system of care or the continuum of care that exists within the counties, we identified that we needed some more support. Our First 5 San Diego funding has been incredible and we continue to invest, but we know that there's a greater need. And during a pandemic, there are some areas that have been exacerbated, and really supporting our youngest children and also pregnant women during this time has been really incredible. And I'd like to share before I stop that our Federal CARES Act dollars and those investments really helped us to position the priority around early care and education, where in the past, here locally, we were seen as the funder. First 5, funding was robust, folks would be like, oh yeah, First 5's got it. But as times have changed and smoking cessation has worked, we knew that we needed to build our partnership a little bit more intentionally and bringing that funding together and leveraging. So thank you for the opportunity to kind of tee that up and share a little bit about how we're moving forward.
Great. Thanks, Alethea. Katie, you want to give us an overview of what's happening in Bend?
Sure. Thank you for having me here today. I'm kind of the outlier coming from a business standpoint rather than being an expert in this really important field. So what we recognized here in Bend, we're in Central Oregon and in the middle of much of what's going on in the rest of the country, a childcare desert. So we've been working on this issue of the lack of childcare, especially for under the age of 3. We've been doing this for 3 or 4 years now. So we came up with a model that's collaborative in nature with our local university and community college, our early learning hub and professionals in that area, trying to figure out the economics side of how do you provide quality childcare that's scalable, that has an economic model that's going to sustain it over time. So we've been working on that. When the ARPA funds came up, we were successful in getting allocation from our state senator and also our county from their allocations to distribute. So what the project is a multi-level program where early learning practice will be developed based on best national practices through the university and the community college collectively. And we'll utilize those programs through their training and certification programs and early education programs to populate this with what is becoming a very severe labor shortage here. So we were trying to identify how do we attract folks back in, and I can get into that a little bit more later. So we'll utilize folks in that area that are studying it to actually help populate. And the final piece of this, as you all know, if any of you have tried to do a childcare facility, that the economics are really tough. It's land, and it's either you own it or you lease it. So we're placing this on higher ed land, both at OSU and also the community college eventually, and utilizing mobile units, so retrofitted mobile homes that will accommodate up to 100 kids from 3 months old to pre-K. And this is a model that they're going to start with students and faculty and also grow out into the community as well. It's also replicable. So you have the program, you have the labor stream, and you have a cost-effective hardscape of the actual place where this will occur. So that's a general overview of what we worked on with ARPA funds.
That's great. Thanks, Katie. And Karen and Libby, I think you're up next, and I'm going to share my screen so everybody can look at the slide that you sent.
Thank you. So as Michelle mentioned earlier, I actually had the unique opportunity to serve in the field before ever joining the Department of Education in my current role. And because of that work in the field, serving in childcare resource and referral, leading a teacher preparation program, providing parent support programs, I was really acutely aware of the needs that I saw in the system. We also are very fortunate here in Louisiana that we partner very closely together at the department and with the field among all stakeholders in the field. And so there's a lot of synergy here in that a lot of times the direction we're interested in moving in from the field is the same vision that the department has had for moving our system forward. And so once I joined the department, we were really able to work together as a team to highlight and prioritize certain activities and goals. And Michelle, if you could move to the next slide. We set these 4 priorities for our ARPA plans. And as we'll talk about a little bit more shortly, we conducted a lot of stakeholder engagement to get to these priorities. And there was, again, a lot of consensus among the entire sector regarding these priorities because it's a plan we've always wanted to move to. So our first priority is that we work to build a better childcare system overall that meets the needs of all families and supports stabilization of the sector. And some of the ways that we're working to do this is through stabilization grants, of course, but also modernizing data systems to have better information about what's going on in the sector, working on workforce recruitment and retention efforts, expanding access through family childcare, and really strengthening childcare business. For our second priority, we're working to expand supply and access to high quality early childhood options and identify opportunities to sustain that expansion long term. So we're looking at ways to add seats, to build local funding for additional seats and programming. For our third priority, we want to ensure that our teachers are prepared and supported to provide high quality interactions meeting the developmental needs of children every day. So we're continuing to do quality efforts related to curriculum, other classroom supports such as mental health supports and social emotional supports, classroom materials, and we're really working to advance developmental screening as well. And then our fourth priority involves bolstering family engagement by developing a family engagement framework that will be used statewide and really empowering families with tools to access tools and resources to support their children's development. So we've really been able to develop a comprehensive plan for how we want to use these stimulus dollars. And we're taking it on as not just a budget plan for how to spend the dollars, but really our vision for where we want to drive the state and the system in the next 3 years, 5 years, and beyond.
And so I'll add here from Karen, as she alluded to earlier, is that this was the vision that we had been thinking about prior to the relief funds coming in from ARPA and the other dollars from COVID relief dollars with CARES Act and the others. And so what it allowed us to do is to just really amplify those dreams and the thoughts that we were thinking and put them into practice. And because we have this inside-outside relationship at the Louisiana Policy Institute for Children with the Louisiana Department of Education, we were able to work collaboratively to really, with other stakeholders, to think about where we want to build back better, how we want our state to move forward. What these dollars allowed us to do, again, was to amplify where we were already moving as a state with the leadership at the Department of Education, who time and time again listen to stakeholders and people in the field so that the work that they're doing is meaningful to the people that really need the support.
Great. Thank you both so much for sharing about what's happening in Louisiana. I appreciate that. And I know, I'm sure that lots of questions have been sparked by those overviews. So I'm going to continue on with just asking some additional questions. Oh, and I did want to let you all know that we do have some additional slides from Louisiana that dig deeper into those 4 priority areas. And we will include those in the materials that we send out post-webinar. So you will be able to have access to that additional information. So we're going to sort of do a round robin here in terms of asking questions and getting responses. And so my first question is, how did this originate? Sort of what was your advocacy strategy, and how were community members and parents involved in your advocacy efforts? And so I think we're going to start with Alethea on this one.
All right, thank you, Michelle. You know, I get really excited when I think back to how this all began, right? And I had mentioned prior as we were preparing, you know, so much has happened in a year and a half. And for us here in San Diego, it started on March 16th. And we had a grassroots coalition that began to form and organize around our priorities for childcare providers specifically. And then, of course, it turned into, well, what else is being impacted at this time? And so as we started to meet, we actually met every single day. And there was a small group of leaders that just really felt so passionately about identifying what those urgent matters were. And I have to share, you know, we dealt with everything from how are childcare providers being impacted at this time as the pandemic was, you know, just coming on, you know, in our regions, and, you know, really elevating the voice of the childcare providers within a broader system, right, that was playing out in emergency operations, right? And we learned that childcare wasn't necessarily a priority. And so we had to really be the voice, you know, for our littles and their families, and of course, the provider base. And so it began in March for us with this coalition that now has really been more formalized. There's a name. We used to just call it the ECE, you know, COVID response team. I mean, we had different names we'd refer to it, or even just a coalition. It is now called the Children First Collective San Diego, and it is made up of amazing individuals that help come together and really plan and prioritize. But the strategy was to develop a policy agenda. And that policy agenda was socialized with our local board of supervisors, because we knew the funding was going to trickle down. We just didn't know how it was going to trickle down into our counties. But we wanted to ensure that our priorities were elevated in a timely fashion, like really expedited, and making sure that all of the board of supervisors heard from the community. First Five is quasi-government in San Diego County, and we are part of Health and Human Services. And so we're like a branch of the county. So you can imagine I had to kind of play myself very interestingly, right? Or how I positioned myself, so to speak. And so I was an internal voice also for the external community. And we also worked very closely with our providers that were still operational to understand what their family needs were. And so there were surveys that were sent out by our local R&R, which is the YMCA Childcare Resource Service here in the county, and just really trying to figure out who was going to do what. And it really was through this coalition that we were able to then elevate the priorities to our board and really identifying with our board chair what that meant. And I'll tell you that it yielded just some tremendous and historical investments, like what I mentioned in the chat, over $45 million. That had never happened in our county. And that, of course, was the catalytic moment for us to now have the 16 million that is earmarked for childcare and early care and education, but also behavioral health dollars and also some other homelessness dollars. And so I really have to lift up the power, right, of the collective. And when you have folks come together with this common vision and common values, it's amazing what you can accomplish. And so I really want to give a tremendous shout out to all my colleagues that made it happen, and being a thought partner and not losing momentum and losing sight, even when we were exhausted. You know, there was a lot going on. We didn't give up. And so we also bolstered up a childcare disaster council that had been really quiet, very silent for years. And a pandemic is different than a fire or an earthquake, right? I mean, we were trying to figure all this out. So I hope that helps you kind of think that through. And I'll also drop in the chat one of the original working families agendas that were developed, so that you can see how the buckets were created and the details behind it. And hopefully it'll guide you in your work. Thank you, Michelle.
Great. Thanks, Alethea. It is amazing what the power of a collective voice from parents and providers can do. So thank you for that. I think Karen and Libby, we're going to hear from you next.
I think, as Libby and I mentioned before, the plan that we developed really is what we have known we needed for years. And the problem, like for everyone, is that we haven't had the funds to do it. We also have needed the past almost decade to really deepen and build relationships between the department and the field. Prior to 10 years ago, early childhood was not within the Louisiana Department of Education. So we needed the funds, we needed the time to develop relationships, and we really needed the impetus to get to this shared vision for a comprehensive plan. So we also got to this plan because it was an opportunity to build off of our existing initiatives. So we've had a preschool development grant, for example, and this is really, we're looking at it as an opportunity to further advance those initiatives we've begun, to really address barriers that have arisen during those initiatives, and to really investigate what pieces have been missing from what we were able to start with the preschool development grant. We've also thought of this as really an opportunity to be bold. What we read in the guidance was that though we do need to constantly think about sustainability, we also do need to think about what is the system you want to build. This is an unprecedented opportunity to begin to launch that. And so we've really used it as a mechanism to further develop an infrastructure for the system that we want and that we do want to sustain. So we've really engaged in stakeholder engagement for the past decade, but obviously when these funds were released, that's just been part of our mode of operating to make sure that we're staying in constant communication and collaboration with the field. And when I say that, I mean with all sectors of the field. I mean with childcare providers directly. I mean with advocates like Libby and others, with local community coalitions, with childcare supports like resource and referral and mental health consultants, and with other state agencies. And so when we started developing this massive plan for an unprecedented amount of money, we obviously started with even more stakeholder engagement. And so we started with broad engagement. We hosted both listening sessions, about a dozen over the course of 2 months, with the same stakeholders that I mentioned before: childcare providers, resource and referral, mental health consultants, families, state agencies, and local community coalitions. And we also hosted a statewide survey so that we could really ask, what are the key challenges and the needs of the field? And we consistently heard these 4 key areas highlighted that became the priorities of our plan.
And I really think this work comes out of an additional body of work with our Early Childhood Care and Education Commission, who really named the dollar amount it would cost to cover children birth to age 3 in our system that are at risk. And so again, it put us in a position, there's money on the table. We were able to say, these are the things that we're talking about, and we're able to move. And as Karen said, because of relationships that we've all built together that create trust and vulnerability to say, these are the things that we need across agencies, it became increasingly important that this stakeholder engagement was the way to move, and Karen and their team were able to do that. But I would be remiss if I didn't say that what also helped this undergirding of relationship is that we are a Pritzker Children's Initiative grant site. And so because of that work, we had been working cross-agency, and we had state leaders at the table to start having this discussion. And then when Karen and their team brought it to the table, they're like, oh, this makes sense. This is what we've been talking about. And so it really is a testament, again, to relationships, especially when you're talking to elected officials and other policymakers, because it wasn't anything new for them. They were like, oh, okay, we've heard this before. Let's move forward with this agenda. And Karen and their team were able to really tune it and make it sing in a way that everybody said, oh, my voice was completely heard as we figured this out.
Yeah, that's great. Those relationships are really key, and sort of working on them and maintaining them is critical in terms of moving the work forward. So it sounds like y'all did some great work in Louisiana. So thank you for that. I think we're going to hear from Katie next in terms of sort of how did this originate and what were your advocacy efforts?
So as I share this with you, one thing that I have learned through doing the advocacy on this issue is that engaging, and even more so now in this pandemic, engaging employers in the work that you're doing is critical, because this is a workforce issue. And not to underplay the value of quality childcare and relief for families and the labor pool in which we can deliver that, which are all things that we're dealing with at a state level in my role in the Early Learning Council. What I started with several years ago really aligned with the U.S. Chamber Foundation and their early childhood program, where they noticed that correlation between how is this impacting the workforce and women's ability to get back into the workforce and stay there on a national scale. So I actually partnered with the U.S. Chamber and did a round robin set of educational and interactive outreach to my sister chambers and brother chambers, whatever you call them, throughout our region to raise this awareness and make the link between if you're having folks having trouble finding labor, it's one of the reasons is because there's not enough childcare, and we have a responsibility to figure out how to fix this. So I just put that out there in your coalition building. That's where I came from, and I met a lot of folks who are experts in this field. We built a coalition that included the higher education system here, the Early Learning Hub, which is a division of the state, our nonprofits, one called Neighbor Impact, that was helping childcare providers and families find childcare in our market, and then reaching out to the providers themselves. And whoa, that was an education for me to try and figure out, so what is it that Katie and a chamber and a coalition of employers in our region can bring to this that will help resolve the issue. So several years we've been working away at this. In fact, most of the money we raised to try and formulate this model was from the private sector. They funded that early work because they saw it as a need. So by the time this ARPA fund came up, much like what you folks were talking about in Louisiana, everybody's going, oh yeah, you know, stop talking to me about it. I get it. And we got the funding, and it wasn't hard. It really wasn't, because you've laid the groundwork and you make your case from many standpoints. And it's also throughout that journey of outreach is you identify partners who bring something to the table, the power of the collective. What do you have that you can bring that will help us solve this? Do you have land? Great. Do you have a direct source to a labor pipeline that can help us beef up more folks working in this line of work? And how do we get them to be paid well? All of these things, none of us are owned on our own. We owned collectively. And that's how we approached it. And not to underestimate how great the state and the local entities here that do this every day have done. They have many, many programs that we don't have time to get into. But forming that correlation between workforce and childcare was key in us getting queued up for this.
Great, thanks, Katie. It is something that sometimes gets lost, is making sure that the employers are engaged and that they can help support the work for PN-3 initiatives. They're an important voice and a powerful voice. So thank you for raising that. So I'm going to start. The second question is about who were the decision makers in terms of making the final decisions about how this funding was going to be spent. How did you influence them? And was there any resistance to these kinds of initiatives? And if so, how did you overcome them? And so we've heard a little bit about this already, but we're going to start with Karen and Libby this time.
So again, we have consistently dialogued with our stakeholders. And so I think because of that, there really is a sense of trust that we've built up over time, so that, these stimulus dollars are more than any of us have ever seen before. And I think that if we didn't already have trust, that talking broadly about this plan without being able to, in April or May or June, lay out a detailed 3-year budget, might have encountered more resistance. But again, that trust has been so vital because we have not encountered resistance from childcare providers or from other advocates in the field. The response we've gotten, orally, by text, in meetings is, this is amazing. This is exactly what we've been looking for. So I think we've been very fortunate to understand the importance of relationships and to honor that. I also think that trust is reinforced by what we've done with the prior stimulus dollars. So we've given stabilization grants to childcare providers throughout this pandemic with CARES funding and with CRSA funding. And we do have infrastructures in place like our statewide Early Childhood Advisory Council and the commission that Libby mentioned that really try to make all of our efforts and all of our activities transparent. So we've been very fortunate with those who actually live in and work in the early childhood field that we have not encountered resistance, but we've done a lot of intentional work to get there.
But where we have seen resistance is with our elected officials, and not of the plan, but of their understanding of what these monies can do and the role that the state still has to play in investing in early care and education. Because it was very clear when we heard that we were going to get this sum of money and we went into a legislative session, what we heard is, y'all have all the money you need. You don't need a state investment. And that, quite frankly, isn't true. And so it really put us in a position as a policy advocacy organization to say, these funds can help us build the bridge. And we developed a visualization of that, of like, these funds absolutely help us build the bridge, but to finish the bridge for a full system, it takes state investment. And so when we talk about resistance, it goes back to making sure that we're also educating our elected officials and legislators so that they understand there's still a critical need for state investment. Even when we think about what's happening in Washington right now and the potential funds that could come in, we still need a state investment. We know that if we don't have skin in the game as a state, we're really never going to get to where we need to for young children. And so always having to explain how the money can be spent, where it can be spent, why this is one-time investment, and that we can't build a system on a one-time investment and invest it all in seats per se. And so having really that discussion with our policymakers at the state and local level. I will say our local officials, if we think about parishes, which are counties everywhere else, they get that. But it's really explaining it to the body at the Capitol to understand that they still have to invest. They cannot get out of it in any way, shape, or form.
Great. Thank you, Libby. Thank you for raising those points. That's great. Thank you, Karen. I think we're going to go to Katie next in terms of who were the decision makers? How did you influence them? Was there resistance that you had to overcome? What happened there in Bend?
Brute force and being a broken record. Honestly, it was an uphill battle at first. So when you're working in the business industry and there are a lot of things to focus your energy on all the time, and to step up as a female CEO, a Democrat, just by way of my political background in what has historically been a Republican type of organization. And I just say that for context. It wasn't easy at first because everybody wants to pat you on the back and say they're there. And it takes a while to push through it and make the business case, which we were successful in doing. If we hadn't done that, this would have been a lot more difficult. So the two entities that made our funding decision was our state senator, Tim Knope, who we've been working with for a long time, and had heard not only from us, but from other constituents, how this was influencing the workforce. And it was easy at that point. The other body was a county commission. That we live in an area that's primarily rural, except for city-specific where I am in, where we have over 100,000 residents. So there are differing views on childcare and who should be utilizing it. And so overcoming cultural views has been a challenge, and it's taken years of work to work through that. And we, like I said, we've been successful. And so I think one of the biggest takeaways I have had from this experience is, first of all, I can't wait to see 10 years from now the results of these young people who are now going through childcare with this much money that we have to do things right. I think we will see profound results, and I hope we're all measuring them, because it's an investment worth making. And the other thing is just keeping at it, keeping your message in front of folks who make these key decisions over the long haul is really critical. And identifying, what's their trigger, what's going to allow them to really see the importance of this, not only from a human development standpoint and a family support standpoint, but an economic one. There's just no reason why we should not be investing in early childhood, and for all of these reasons. And that just takes sustained effort.
Yeah. That messaging piece is critical, just getting consistent and keeping that brute force piece that you said, just being a broken record. Thank you, Katie. Alethea, you're next in terms of advocating and overcoming resistance.
Thank you, Michelle. I'm so excited because when I hear my fellow colleagues on this call talking about what was most important, I feel that everything that has been shared, I don't want to necessarily reiterate what they've already said, because it was yes, yes, and yes, and yes, right? And I'm watching the chat, and it's so exciting, right, to be able to share ideas and thoughts and how we overcame some of those challenges. And one of the reflections that I had with this question was around the lack of understanding, right? And Katie, you were hitting on this, like there's no reason why no one should invest, like everyone should invest. Early care and education, quality early care and education is really about our economy. And in the moment when families are receiving quality early care, right, for their children, they're able to work. And so how do we message, right, our business case for quality early care and education? And one of the things that we found was making sure we had a consistent message. And one of the things we learned in the years back was that we were so siloed even within our sector, right? And there's different modalities, right? You have the federally funded Head Start programming, early Head Start, you had the state funded, you also had private childcare, right? Private centers, private family childcare. And when we began to really look at this ecosystem here locally, we understood that we need to come together and work together to make sure that we have a message of solidarity around what our children need. And I believe that that has been very, very fruitful for us because locally we were able to come together. And when it comes to the challenges or the how you posed it, Michelle, the resistance, I really feel that it was competing priorities, right? It's not that our board didn't believe in the need for quality childcare. It's that there was so much need out there and we have limited resources. Like, how do we then have the carve outs? And, many of us have watched, our elected officials in these meetings, and it's really difficult, right? Because then you start nickeling and diming initiatives, and that's not what we want to do. And we do believe that the upstream, starting the earliest, is really going to yield that return on investment, right? But how do we get from the downstream, actual work that needs to happen to really investing early on? And so I really feel that, again, maintaining the course, don't lose sight of that, and continue to evolve it. Like, it can't be stagnant. You can't be just this document you created last year, because you got to have input that comes from your providers, your families, right? And then also the businesses. And so I love how, Oregon has been able to include their business in this, because the local chambers are super important. And we have not arrived there yet, actually. And so it's something that we're aspiring to. And I hope that I can connect with Katie and others that are really working on this, because we don't know what we don't know. And so I'm really hopeful that we can continue to really just maintain the course and not let those dollars go anywhere else where they've already been earmarked, right? And so again, this is about really laying some strong foundations in an old system that, quite frankly, it's been around for a long time, right? And it's time for some big change, but change is hard, especially when you're moving a big ship that is not always together. And so hopefully that resonates. And it's what is the saying? We're flying the plane as we're building it. I almost feel like we're in that. I hear that a lot, but it's true. And we hope that we can listen to our community as well as they're experiencing the system as it's playing out, right? And that's super important. And I know Karen mentioned a little bit about that as well, that feedback loop that has to be available and open, and then we got to respond. So thank you.
Right. Thanks, Alethea. That was important information that you just shared. So thank you. My next question is about implementation. So where are you all in terms of implementing these initiatives? And we're going to start with Katie this time.
So we've got the pedal to the metal right now. We are in design phase for the retrofitted mobile classroom, for lack of a better way to describe it. They are hiring right now, and boy, is that tough with the labor situation, for a program director working out of the university to develop the program and also the operational model that we're going to be utilizing. And then we are tuning up some of the community college and higher education programs to queue up that labor workforce. Simultaneously, we are asking for a different funding stream to pay for apprenticeships, essentially, so that when we take these students from these programs, we pay them for the time they are spending with the kids in the child care lab. So multiple things hitting all the buttons at once. We're hoping to have this up and running within several months.
Great, that's exciting. Thank you, Katie. Yeah. Alethea, talk to us a little bit about implementation.
Well, I'm not as far ahead, or our county isn't as far ahead as our other participants on the panel, but what we're in the process of is still gathering some feedback. So one of the initiatives that I know is further ahead is the child care foster care program, the child care bridge program that we have. And so that is closer to being contracted out to ensure that the dollars come to the families so that they get a voucher, right, that they can then use for a provider of choice. So it's going to be similar to like an alternative payment voucher that they would have received. And so the idea, as I mentioned earlier, was the gap funding. And so that one is much further advanced in terms of implementation. And so we hope that we can one, be successful, right? And that families utilize the benefit, right? And so come back to me in a year maybe, or 9 months, and hopefully I could let you know how we did. And so that's the first line item that is being activated. And the others, in terms of facilities development and improvement, I know the county is looking at a county sponsored child development center that's going to be on site county property. And so that right now is really just conceptual. I know the board letter came yesterday, and so they're vetting it through the process. And then the rest, which is really the workforce pipeline and the stipended grants to providers, that I saw somebody had mentioned, really interested in learning more about that. It may have been Susan. I'm not sure, but we too are really looking forward to learning about how others are also doing this. But we have a tremendous voice locally around, one, we need to produce the workforce, right? So working with our community colleges and our institutions of higher ed. But if rates, like with wages, are very low, especially in San Diego, we're a high cost county. Housing, like to buy a house, where average home is like 700,000. Your typical 4-bedroom now is almost $900,000. I mean, it's pretty insane. I don't know who else can relate to that insanity in terms of housing costs, right? On the West Coast. Yeah. Many are leaving us. And so that's the other issue we have, is that our youth might be studying here, but they're not studying to become teachers. They're not going into the field. And that is so unfortunate, because we know it's so valuable. And so we look forward to working with our higher ed institutions, and also advocating for wage comp studies, and really just advocating for not just a living wage, but a professional wage for our workforce, because it's not okay. Sorry, I can't offer more in terms of that question, but we are definitely focusing on really appropriating that $16 million in a very meaningful and thoughtful way.
Well, Alethea, moving forward in planning, count as in terms of implementation. So we all look forward to hearing more about what happens in San Diego with these projects. So I think it's on to Karen and Libby in terms of where are you in terms of implementation?
So we have encountered some terrible disruptions here. Hurricane Ida was an extraordinarily devastating storm that I know devastated other regions of the country as well. What many people may not realize is just how impactful it was here in Louisiana. And so actually earlier today, before coming into this meeting, in another meeting, I learned that we have 100 centers who have experienced significant damage and will be closed with no definite reopening date. And that is more than we experienced in Katrina, or in 2016 when we experienced 500-year floods. So it was a truly devastating storm, but and there's a lot of work we'll need to do to support that recovery and that rebuilding, and we have begun that. But we have, despite that, continued forward with the work during this. So our first round of, we really started with stabilization and access efforts from our 4 priorities. And so we had already in July issued the ARPA stabilization grant application to childcare providers, and those funds were scheduled to go out in August. And despite our state offices being closed and much of the capital city being without electricity, we are really, really happy that we got all of those payments out on schedule, because unfortunately, those payments are now even more critically needed by providers in those 25 disaster parishes. So we have gotten out over $100 million in those stabilization grants already directly to providers. We use that ARPA stabilization grant application to ask childcare providers about their actual operating costs to help us begin determining true cost of care, so that, as we all hope, we can move past the market rate survey and really begin to pay providers based on the true cost of care. It's our hope, in response to a lot of what we're seeing in the chat box, we don't think we're going to be making a pay increase one time. We don't think we're going to be increasing the subsidy rate one time. We think we're going to work to increase the subsidy rate and then push for, efforts to make sure that the workforce is paid at a fair living wage and a sustainable, successful living wage, and then see cost of care rate increases go up further. But we want to start somewhere. And so we've really been studying what the current true operating cost of care is, and we're going to be proposing some rate increases in the next 3 months to our governing bodies here. In terms of access work, we've been giving funding directly to our parish level early childhood community networks to do landscape analysis and really begin to examine where are the gaps in access equity and what strategies are needed to build new access and supply, whether it's in unused school classrooms. We really rely on diverse delivery here in Louisiana, whether it's in other public buildings, whether it's through expanding family childcare. And then we've also started pursuing even more mental health supports in the state. So we're fortunate to have a very strong mental health consultation program that serves all of our childcare providers, but we're looking at potentially funding clinical services as well.
That's great. Libby, did you have anything to add to that?
Yeah, Karen covered it all.
Okay, perfect. Thank you. So next we're going to turn to the issue of equity and sort of centering equity in your programs and in your initiatives. And we're going to start with Libby and then Karen, if Karen would like to add something. So tell us about how equity played a role in the work that you're doing.
Absolutely. So first, to contextualize, we're a deeply red state. And so you have to understand that to understand how we talk about equity. And many times, most of the time, when we talk about equity, Karen and I have a colleague that talks about equity in Louisiana. We call it stealth equity. And what that means is that we can't really use the word equity. We have to talk about geographics and the different geographies across the state and making sure they're represented, talking about income disparity and those types of things. So really talking about equity in directly observable terms so that policymakers, business leaders, and others in the state really understand what it looks like without necessarily using the word, because the word will turn off people from trying to do what needs to be done. And so that's one piece of the work that we do. And so when we're thinking about all the things that Karen just shared with the implementation and what we've all collectively bought into about the plan and these 4 pillars that we think are critically important to use this money on, it becomes really important to utilize these community networks that the Department of Education has built, and we call them the Ready Start community networks. And these Ready Start networks are the places that are proximal to the work. They are proximal to parents and the child care providers, and that they know the need. And so when we're talking about equity, it's really listening to our locals and how locals influence the work at the state level, and then vice versa, how state influences the local level. And an example here is that we have several communities in Louisiana that are making local investments to increase access to high quality early care and education. One in particular is New Orleans. They've invested $3 million of their city budget in infant toddler high quality early care and education. But what that allows them to do is we have on the books our early childhood education fund that's a dollar for dollar match when we have enough money in that fund. And so again, that's a piece of letting the local say we're bringing something to the table and the state can then match it. And part of the funds that Karen and team are dispensing is saying right now we don't have enough money in that fund, but we have locals that have brought money to the table, so they're able to really think about how to use these ARPA dollars to be able to do that match as well. And then when we're thinking about equity, is that our parishes that don't have a revenue source like a New Orleans or a Baton Rouge or somewhere else, that we make sure that we have equitable distribution of resources. And I know Karen and their team at the Department of Ed and then others that we all talk with and work with is we need to make sure our most underserved parishes, our most underserved communities are getting what they need. And so when you look at the different type of formularies that are in our state, that takes into account to make sure that we're having equitable distribution of resources.
Thank you. Karen, anything to add? Nope. Okay, great. Nice job, Libby. You covered it all. So we're going to go to Katie next. Tell us about the equity approach in Bend.
So that's a little bit more difficult for me to really talk about, except on a, well, let me do this. Let me start on the state level, that this is a really huge focus. We've just been doing rulemaking for new legislation that came out of last year of how to ensure equity. And I'll start there because how it boiled down to our project is finding places that can align with the baby promise and preschool promise programs that our governor, Kate Brown, implemented to help families in need and equitable access to childcare. And how do we match that with actual physical childcare that is available? So using that lens and putting these 100 slots together, we focused a lot on the student body of community college. Many of these folks are going to school on what's called the Oregon Promise, which is a promise if you're under a certain wage, socioeconomic stature, that you don't pay for college. And the other piece of it is OSU, Oregon State University, the Cascades campus. I want to say something like 40% of the students there are Pell Grant recipients. So these are folks that don't have access to enough money or the ability to pay for childcare. So this was a big part of our decision. The faculty there also will have access, but then they're also opening up the remaining slots of this particular campus and other ones that we will build and replicate to a certain percentage of baby promise, preschool promise level folks. So it really started at our state level, and maybe that speaks to Louisiana and California as well, and filtered down, I think, the way it was supposed to from these equity policies that are coming out of the state, so that when you look at projects like this, that you're including that lens in the projects that you put on the ground. And it brings the piece of a physical place for it to happen to match that up with the people who are getting assistance and in that equity slot of needing help.
Great. Thanks, Katie. It's nice to see the state taking the lead on equity, focusing, centering equity in the work. So Alethea, I think we're up to you in terms of your equity approach.
Okay, thank you, Michelle. Again, just listening to what Katie was saying in terms of, let's start at the state. One of the things that I wanted to share was locally, we had strong representation with a new union. And so the Child Care Providers Union, CCPU, had formed. And they are now identified as, a bargaining unit for childcare providers statewide. And they had partnered with UDW, or is it United Domestic Workers, right? I think they use United, sorry if I say it wrong. But UDW and CCPU joined forces to really address disparities in wages and rates, and what an opportunity to think about equity from that space, because we had to sit back locally and think about the ecosystem of funding, like who typically gets the dollars, right? And when it's state dollars coming down, who are benefiting, who's held harmless during this time, getting paid and not operating. And I don't know how many states did that, but in California we did. And so state contracted providers were being fully reimbursed, while during the height of the pandemic having closures, right? And you can imagine that really brought up a lot of concern, right, from providers that were staying open yet not receiving hazard pay. And so we really took a step back and thought about how do we ensure that, you know, all of our provider base here in the county were a part of that conversation, but that also then flowed to the entire state, right? And so there was a tremendous voice that came forward in terms of, did you know we have over 4,300, you know, licensed providers in the county? Of those, like 3,300 are family childcare providers that are small business, women owned, and usually women of color. And so we were talking about this huge workforce here in the county that was really struggling. And so when we thought about equity, we thought about who needs to be supported at this time. Where do we need to really advocate and focus on? And so we did that from that lens. And also, we're looking at like furthering, how do we ensure that they are present in these conversations? Because typically, you know, when we look at our local childcare planning council or the benefits that we had put forward in our own quality early ed initiative here in San Diego County, it was usually the Head Start or the subsidized programs from the state, right? Center-based were the traditional avenue. And maybe reflecting back to when it all began in 2006 for us, with the whole race to the top and, you know, preschool for all here locally, they were the early adopters, right? So it was easy to bring them into that quality early learning and coaching. But here we are, fast forward, we too made a big shift in terms of some of our investments with quality early learning. We call it Quality Counts California. That's QRIS for the rest of the nation, right? And every state does it a little differently. So for us, we made a big shift this past year to really expand our reach and in terms of those experiences that we want children to have. And so really looking at access, you know, equitable access, quality experiences for children, families, and providers that then lead to the most amazing results, right, for those little ones and the families, right? We're talking about healing and recovery and resilience and just really positioning families for lifelong success. And so what does that look like? And so I'm very proud of what we've been able to accomplish here in San Diego. And the new endeavor, it's called Learn Well. It's a big program, and it didn't help. It was July 1 of last year when we started it. And you know, July 1 of 2020 was a tough time for many. And so we didn't lose sight. We're still moving forward with it. And I'm hopeful that of early care and education. And then, as I mentioned before, hoping that, you know, we're looking at business and bringing them into this conversation when we're looking at equity and really having some bigger advocates to be a part of our organizing voice or the collective, as I mentioned earlier. So more to come, but thank you.
Thanks, Alethea.
Yeah.
We have one more question left, and we have, let's see, 12 minutes. So we're going to ask you to sort of go through these questions, this last question quickly, but fully as well. So the next question is about sustainability. What are your plans for sustainability? And also, what advice would you give to other advocates in terms of moving this work forward in their state or local areas? And Katie, I think you're up first on this one.
So that's the million-dollar question, and it gets to the economics of the models that you're putting together. So we looked at this in several ways. That there's a certain formula that works well with this, and it's the availability of free or cheap land or facilities. And that helps one of the legs of the stools not have to be funded, which makes this affordable and accessible to many. And so our higher education institutions are regional in nature. They have access to land all over. And so that was one of the critical factors in making sure this was something that could be duplicated and sustained. The other piece that is, I think, probably even more important than that, and has flipped over the last few years for me, is that sustainable labor pool. And that means not only just great education programs, but how do we raise the wages? How do we get the economics to work so these people can make a living doing this important work? And the way we've approached this is going back to something's got to give. there's got to be a savings on the land, the lease, and it's not going to be the labor, or needs to be some subsidization at some point. So this model allows for subsidization to happen in the land and the facilities piece, and to some degree, at least in the midterm, for the labor, because we're augmenting the childcare with the students and federally backed money to pay them to do this work. But that to me distills it down from just the ability to deliver quality childcare and the economics of it, that you have to perpetuate some sort of a model that allows relief in one of those areas, so that can pay people well, folks can afford to go there with their kids, and you can sustain it over time.
Thanks, Katie. That's important information, the notion of the economics of sustainability and addressing one of the huge factors, or one of the huge costs that childcare providers face. So thank you. Alethea, tell us about sustainability or advice you would give to other advocates.
You know, one of the things that we have learned in terms of the advocacy or the organizing is the education piece, right? We need to educate about why this is so important. So that means you have to publish, right? And so there needs to be an investment in some local studies or white papers, briefs, whatever you want to call it. We found that is very useful. So having those tools that you're equipped with when you have these conversations that allow you to show the true landscape of the condition of childcare or the state of childcare in your region, right? That's really, really important, because when you come equipped with that, folks will look at it. You have an executive summary, hopefully, to then help them process that information, because don't assume that they're experts, right? Most often folks are not. And so when we talk about our system, we ramble it off and we may lose people, right? And I know, Katie, you're probably smiling because you represent business, right? And so you know what I'm talking about. And we had a childcare plus workforce report that had been published. And I believe that I didn't drop that in the chat, but I'm going to later before we end, because that was a really amazing opportunity that we had locally, where philanthropy had made an investment in this report with our San Diego Workforce Partnership to better understand, where the gaps that were occurring, where were the investments that were needed. And so a lot of, for us, is really the prioritization around the needs, but also I think not being afraid to go to your electeds to talk about flexibilities in local ordinances, right? There's certain rules with where you can get a license to operate, right? And there's conditional use permits that you have to then apply for, and that city may or may not approve it. And so really working within your municipalities to help them also understand where maybe regulations and ordinances need to be changed in order to allow for expansion. Where is there space? We're very saturated in terms of our building space, or it's not available to then create a childcare space. I used to be a childcare operator for a Head Start program, and I remember looking for a facility where we wanted to have an admin and we wanted a training hub, but we wanted to create a model training center. But the facilities, they said, oh, you're going to have to apply for a CUP and they may not approve it. And I'm like, oh my gosh, it's like the unintended consequences of these rules. And again, if we're not having these conversations with the people that are creating them, how do we ever know how we can advance it? And so we're really looking with county and city officials to really elevate the awareness around that. And accessibility is around the space, right? But then again, we're talking about affordability and flexibility within the system that our families have. And so we definitely are going to continue to have some new reports that are going to emerge for us. We are working with philanthropy to help us elevate that message. And we're hopeful that what we learn, we can then put to action. And so that's where we're headed. And so I hope that helps all of you when you think about what advice. I think we just need to publish some really useful reports that'll help us guide the conversations that we need to have. And really just work together. Honestly, I know that folks can be in their silos and they'll say, well, we've done this and this is how we've operated and it's easy for me. And it's hard to have to work together, but go through that experience so that you'll see that big long-term investment and return. I am very hopeful. There's growing pains with it. And I hope that I could hear from some of you that in the future want to connect or, come together. I think a lot of us, we have this common vision for our littles being in a high quality early care and education system, and then the families also being, surrounded with that supportive system. And then of course our workforce, right? And so I've been in this long enough to know that, times are changing and they way overdue, right? And so I can't wait to see this happen during my tenure. Because if not, I'm going to retire and then I'm just going to become an advocate. I'm going to be a lobbyist, I think. I told my husband, that's what I'm going to do. I'm going to go fight for our babies because we need to get that fund there. So thank you so much, Michelle, for the opportunity to share some reflections about our work in San Diego.
Thanks, Alethea. I appreciate that. I vote for lobbying as much as possible and standing up for the littles, as you call them. I love that. So Libby and Karen, talk to us a little bit about sustainability and advice for advocates. We have just a few minutes left.
Absolutely. And I just want to echo what Alethea was saying about the policy and the advocacy work and having the ability to lobby that we do as a 501c3 nonprofit organization. There is the allowability to do that, and it gives you also the ability to affect great change. And I will say, I say this all the time, I didn't know I could have this much fun working. And so, when you have the opportunity to really be educated on the subject matter and the skill set to work with people, there's the ability to change the course. And so if I think about really, what my advice would be, and we're thinking about sustainability, I mentioned earlier about our early childhood education fund. That's a 1-to-1 match for locals. I think that's one area that I think that people can be creative with, especially when you think about fully funding a child care, early care and education seat. We know that our subsidy rates are not where we would want them to be to actually cover the cost of care. We're making policy shifts, as Karen mentioned earlier, all the time on that. But when you have this kind of match fund going on, you can actually cover the cost of care, and that becomes increasingly important. When we think about sustainability, I'm going to hit this over your head. We have to have state investment. We can't get around it. The federal government can't do all the things. State government can't do all the things. Local government can't do all the things. But when we match all of those funding pools together, we can create a really robust system for young children. And in our opinion, little people are the best people on the planet. So why wouldn't we want to do these things for them? And so we continue to hit on state officials. We need your investment. If you think about our budget right now in Louisiana and what we invest in young children, it's 0.5%. That is unconscionable. Our state budget is a value proposition. So we really have to think about the sustainability piece. And as advocates and policymakers, we're creative about how we do that. So we just passed legislation this past session related to sports betting. So 25% of that revenue, up to $20 million, goes into this early childhood education fund. I hope in 2 years I go back and I have to lift the $20 million cap. That would be my greatest hope. But whatever other revenue sources that are going to come into the state, we want to make sure that we can direct them to the fund and that we can direct them into early care and education so that we can really foster a system at the end of the day. And then I'll kick it over to Karen for her insight as well.
And absolutely, in addition to braiding funding streams, I think another key sustainability, key to sustainability is continued engagement. So we need advocates like Libby who are doing this for us day in and day out, but we also need advocates at every level. We need more people in every community talking to more people, parents, business leaders, local government leaders about the importance of early childhood and the importance of funding early childhood. So one of the things that we actually started a number of years ago, Tulane University started, but that I think led to some of our successes in terms of educating state legislators, was an early childhood professional learning institute. So I just think we need continued engagement, and we constantly need to expand the pool of advocates. And in terms of other advice, listen, pilot, evaluate, pivot, keep pushing forward, persist, and keep listening.
I would also add, because of something Karen said, is some of our biggest advocates now are our business community. They are employers. So Louisiana was one of the first states to put out how much it costs the state and our employers when families don't have access to high quality early care and education. We just revisited that study and now know it costs in loss of revenue to our state $1.3 billion. And so, when you have people like Katie invested with the chambers and the business communities, that's how we've been able to build goodwill across the aisle as well. So it's not, a Republican or a Democrat issue. It is our issue. And this bipartisan nature of young children that we've created with business leaders throughout the state, I think has been really monumental into getting people turned on to this issue as well.
To piggyback off of one other thing that Katie said as well, I think workforce is critical to any sustainability. We cannot continue to put the hardest work at the lowest wages on the backs of childcare teachers, especially most of whom are women, and many of whom are women of color.
Absolutely. And I hate to do this, but we're going to have to move on. We are almost we're over time, actually. Want to let everybody know that we have some additional webinars coming up. One on doulas that will be, will be on October 5th at 1 p.m. It's called Improving Birth Outcomes, Strengthening Awareness of Support for State and Community Doula Networks. I believe that registration link is already in the chat. Then we've got parts 2 and 3 of the Justice from the Start webinar series on family support and on health. Can't leave you without putting a plug in for the NCIT Exchange. If you are not a member, it's a great place to share resources, connect with your colleagues, connect with national experts all around Prenatal-to-Three initiatives. And I believe that the link to sign up for that is in the chat as well. And there will be a continued conversation about these issues on the Leaders and Champions neighborhood and a special discussion forum for you there. So I apologize for going over. Thank you for being here. Thank you to our speakers, Alethea, Karen, Katie, and who did I forget? Libby, sorry about that. Thank you so much for our excellent speakers, and everybody have a great rest of your day and stay well.